joint, what they don't track is that if people walk for years, decades, that they're truly going to get better. You're not offloading enough. Offloading is so critical when it comes to hip arthritis. If you go walk on an irritated cartilage, it's only going to further irritate it. You're going to aggravate it. Here are 7 reasons why walking does not help hip arthritis heal. If you can't fire your glutes while you're walking, then walking is going to be a detrimental exercise for your hip arthritis. There's this idea of a muscle imbalance that's affecting hip arthritis. Let me explain it to you really quick. In the ball and socket joint of the hip, you have muscles on the back, those are your glutes or your butt muscles, and you have muscles on the front, your hip flexor muscles. People that have hip arthritis have an imbalance where their glutes are weak and their hip flexors and thigh muscles right here on the front are too strong. And what that does is it pulls the ball forward on the socket. Because the muscles in the front are too strong, it yanks it forward and it makes the ball rub badly on the socket. So if you don't fire your glutes well because you have weak glutes, then you're rubbing the ball on the front side of the socket every time you go to walk, and it's just grinding your hip joint worse. If you have a bone-on-bone hip joint, it's just rubbing the bones on each other worse. You need to get stronger glutes on the backside so that you can pull the ball into the center of the socket and have normal forces in the hip. Then walking can be a helpful, productive exercise or activity for you. But if you don't feel your glutes working while walking, then it's not good. It's making your hip arthritis worse. Number 2 is if you have this imbalance, then that means that your quads, the muscles on the front of your thigh, are going to be dominant. You'll use your quads quite a bit during walking. The quad muscles, there's 4 muscles: vastus lateralis, vastus intermedius, vastus medialis, and rectus femoris. Those are the 4 quad muscles that help to extend your knee. They help to straighten out your leg right here. But one of those muscles, the rectus femoris, that muscle in particular connects from the kneecap to this point in the hip bones. And so it crosses the hip joint and it can act as a hip flexor. And so if you're walking for exercise and you have this imbalance, you're using your rectus femoris, one of your quad muscles too much, and it feeds into that imbalance where it pulls the ball forward on the socket, rubbing the joint inappropriately, making your hip arthritis worse. Number 3, there's a muscle called the psoas muscle. It's a hip flexor muscle that lives in this area right here. It's a muscle that attaches to the spine bones up in the lower back, and then it runs down through the middle of your body and it connects to this part. It wraps around this way and it connects to this part of the thigh bone, and that muscle's one of the primary hip flexors. If your glutes are weak in the back because you have this muscle imbalance, your body's trying to find stability and a way to move when you're walking or doing any motion, any everyday motion. And if glutes are weak, this psoas muscle commonly compensates and it causes a lot of compression through the joint. Because the muscle is a vertical muscle, it's mostly vertical, when it tightens up, when it shortens, when you use it, it compresses the ball and socket joint and it wants to pull it a bit forward. You're going to be psoas dominant whenever you're walking, whereas you should be glute dominant, because ideally if you're using the glutes, those glutes help to move your leg backwards this way and propel you forward during walking. But most people that go walking for exercise, if they have hip arthritis, they don't feel their glutes working. They feel muscles on the front of their hips and thighs working the most. Number 4 is your hip joint is already irritated. If you're hurting and then you go try to walk more, walk through pain even, that's not a good thing. Because if the lining of the joint is irritated and you have that deep hip pain, people usually feel it in the front of their hip where their leg folds against their body, where it meets their body. That area is where hip pain from the joint is referred to. And it's a sign that the lining on the inside, the cartilage in the joint, is irritated. If you go walk on an irritated cartilage, it's only going to further irritate it. You're going to aggravate it. So it's not a good idea to force your way through pain and make yourself walk because you were told to walk or because you saw somewhere on the internet that walking's a good thing, because there was research, medical research that said that walking's good, but it hurts. It's the same idea as if you're picking a scab. If you have a cut on your skin somewhere, It's healing. It's irritated though because you can touch it and it hurts. That means it's irritated still. You need to let it fully heal so that you can put pressure on it without causing pain. But if you're trying to do something aggressive to that injury, you're only going to aggravate it. It's going to bleed worse, and then you have to start the healing process all over again. That's what you're doing if you try to walk on an irritated hip joint. You're just irritating the injury more, making the injury worse, keeping it irritated for longer, and you're not progressing and healing. You're actually injuring yourself more. Hey, I want to interrupt the video really quick to tell you about our hip arthritis recovery program. This program has 3 major components in it that you can take advantage of. One is it's got a curriculum. It tells you exactly what to do to heal your hip arthritis, to go from not being able to walk, having pain in the mornings, stiffness in the mornings, fear that you're going to have a hip replacement eventually. It tells you all the steps in the curriculum, but then we've also got coaching. You get group coaching that's live with me and my recovery coaches, plus you get into a community of other people that are on the same journey as you, trying to avoid having a hip replacement and getting back to doing the things that they love to do. Learn more about this program, the Hip Arthritis Recovery Program, in the link below here in the description. Back to the video. Number 5 is you're not offloading enough. Offloading is so critical when it comes to hip arthritis. That means using a cane, a walker, or crutches so that you can put pressure through your arms and not put your full body weight through the hip that hurts. If you can get around this way and get the hip pain down further and further, maybe even no hip pain when you're walking, when you're standing, then you can begin to get some movement in, hopefully using the right muscles, the glutes and not the quads and hip flexors too much, so that you can tolerate more time on your feet and be able to do more activities. Offloading is not typically recommended for people with hip arthritis until it's really bad, until you're limping so bad that you need to offload. You have no choice. It's obvious that you need a cane or a crutch or walker, but really you should be offloading sooner, as soon as it starts to hurt. That way you have a chance at using the right muscles and you're not aggravating the joint too much. Number 6 is you're walking too much likely. If you can walk 1 mile or for 10 minutes, whatever measure you want to use, and it doesn't hurt you. But if you walk more than that, there's a threshold usually where if you walk more than 1.2 miles, then it starts to hurt. If you walk more than 15 minutes, then it starts to hurt. If you force yourself to walk beyond those thresholds, then you're causing more irritation inside the joint, and it's not a good thing. Now, even if you're using the right muscles, because if you're using the wrong muscles, you shouldn't be walking at all until you figure out how to use those muscles. Of course, there's essential walking you have to do to live, to get around the house, to get around your daily activities that you must do. Do that, but ideally fix the root problem, the muscle imbalance, so that you can walk and it's productive for you. But then once you can walk a certain amount and you know your threshold, even if it's good walking, you're using your glutes properly, you shouldn't be exceeding that threshold on a consistent basis, because then you're going to be consistently irritating your cartilage inside your hip joint. You need to back off and do what you can tolerate without making it worse as best as possible. Reason number 7 is that medical research is so superficial. There's a lot of healthcare professionals hanging their hats saying that there's solid medical evidence showing that walking can help hip arthritis. But in reality, that evidence, that research study, those studies are very superficial. They don't make a direct connection between cause and effect on that walking is what actually made hip arthritis better. They're just showing a correlation. They're showing that as people walk more, they tend to feel better. And then it only goes so far. It stops beyond a certain point. What they don't track is that if people walk for years, decades, that they're truly going to get better. Because what usually happens is walking does feel better when you start off, especially if you haven't been doing much. Because the fact is you haven't been doing much. So it just feels good to get out. It feels good to be in nature. It feels good to get outside the house and let the air hit you. It feels good to get some sunshine on you. And so for a few weeks, maybe even just a few days, you might feel okay walking. But if you keep consistently doing this as an exercise to help heal your hip arthritis, if you have that muscle imbalance I'm talking about, it's just a matter of time before that ball is not aligned well in the socket and you're using all the muscles in the front too much. You're rubbing that joint, causing way too much pressure, and then it becomes irritated, and then walking doesn't feel good anymore. And it's so confusing for healthcare professionals even because they'll say, well, you've been walking 20 minutes a day, every day, or 5 days a week, whatever frequency, and that was more than before. I don't know why you're hurting more. Then they'll blame it on your age. They'll blame it on some other factor, past injuries, your genetics, and they'll say, you know what, I guess this isn't gonna work out for you, so you might as well just get a hip replacement. When in reality, the research hasn't even been done on how these muscle imbalances work. But I've got tons of clients, we have tons of people that we work with online that are using their muscles better when they're walking. They're firing their glutes. They're stopping walking. They're reducing the amount of time that they're walking to figure out how to fire their glutes and then getting back to walking. So I'm not saying walking's bad forever. I'm saying walking's bad until you figure out how to do it right. So for a short time, you need to stop walking, figure out how to do it right, then walking can be very productive for you. Hey, if you want to learn more about the muscle imbalance and why those quads and hip flexors are such a big problem for hip arthritis, check out this video here next.